Hello, I'm Chelsea Jones, and I'm here to speak on advancement in sickle cell anemia treatment in the 2010s until present. Hydroxyurea continued to be the first line of care for patients with sickle cell anemia. It was the standard, but not only was it the standard, many people weren't taking it and weren't using it to their advantage. Not only was hydroxyurea the standard of treatment, there was also gene therapies, blood transfusions, and even ultrasounds that were used for early detection and also treatment plans to treat the disease. When I did some research this week, I saw that many people just weren't getting medicated and weren't following a treatment plan due to health disparities and discrimination. They felt judged. They felt like they were going to be talked about, or they were embarrassed. So it's up to healthcare providers and even nurses and healthcare administrators to ensure that it is a judgment-free zone when patients do come and seek treatment. And ultimately, it affects the patient. So regardless of embarrassment, me personally, if I had the disease, I would still seek treatment, but I can't speak for them. I'm sure it's very heavy and very hard to face a provider and not feel like you are being heard based on how you look and how you feel. I also looked at some therapies, and please excuse me if I butcher some of these pronunciations. Casgevy and Lyfgenia were some of the gene therapies that were used. And they were used as engraftments that were placed, and those engraftments were used, and it helped increase the production of fetal hemoglobin. Of course, we know that fetal hemoglobin helps with the sickling of the cells, which ultimately helps oxygen flow and delivery throughout the body. Sickle cell anemia is when red blood cells are sickled and causing a reduction of blood flow through the body, which increases pain and just ultimately a horrible feeling. This is why these people need pain medication, PCA pumps, and they come in for a sickle cell pain crisis. I work in the hospital, so I see a lot of people who are taking hydroxyurea as everyday treatment, but they are coming in for pain crisis and they need fluids, pain medications. Sometimes they need blood transfusions. This came into play in 2013. It was approved by the FDA. This study that I did see, of the 44 people that were treated, 31 people were revisited and reassessed, and of those people, 29 saw an effective outcome. I do see that Black people and Hispanic people are the ones that are mostly seen to have sickle cell anemia, and there are a lot of existing healthcare disparities, even though there is Medicaid available and all these resources available for these children and adults. So I think it's up to us as a community of not only healthcare providers and as people to be the voice and just advocate for these people so they can know